Like waiting for takeoff, no?
I hope the rocket doesn't crash. Give people some more time, a few more minutes.
Some people cannot connect from some reason.
Should I start?
כן. טל אומרת שכן.
Okay.
זה רץ בפייסבוק, אז כדאי להתחיל.
Okay. So I will start. So hello everyone and welcome. It's a pleasure to have all of you here with us today at this webinar, end of year webinar of the Israeli Forum for Sustainable Nutrition, Steinhardt Museum of Natural History. We're really delighted to have all of you here from Israel, from abroad, wherever you are. Before I start with our guests, I'll pass the microphone to Tamar, the chair of the museum, for a few words.
Thank you, Alon. And hello, everyone, and welcome to this evening's webinar. The last webinar of a very challenging year. The interface between food production and consumption, between agriculture, environment, health, and nutrition is a key juncture in the future of humankind and our living environment. Managing agricultural systems sustainably and preserving the ecosystem while protecting the health of a huge global population is by far the greatest challenge facing us in the 21st century. The Steinhardt Museum monitors and surveys Israel's terrestrial and aquatic landscapes, provides support to the planning and management of Israel's ecosystems and agroecosystems sustainably, supports the plant protection services in halting the spread of invasive species, and monitors fish populations in the Mediterranean Sea. The Israel Forum on Sustainable Nutrition brings to their table their amazing expertise on nutrition and human health, as well as other aspects of the environment. This webinar, as well as other activities, are the fruit of our strategic partnership. A year ago, we launched together the Hebrew version of the Eat Lancet report and had high hopes for a year of significant, relevant activities. Like everyone else, we had to tailor our ambitions to reality while learning what eating the wrong animals can do to the planet and what a pandemic can do to how and what we eat. We hope that in the coming 2021, we can return to our ambitious plans and that those will include conducting public and professional events together in the museum. We have wonderful speakers in today's webinar, so I wish us all stimulating and exciting event and a healthy and significantly less challenging year 2021. Good evening.
Thank you, Tamar. So as Tamar mentioned, we launched the Eat Lancet in February of this year, and this year dedicated to thinking and implementing many of the insights that were brought together in that report. Unfortunately, the world has changed completely ever since. A global pandemic that has wreaked havoc, causing mass economic downturns and large health burdens. It has also challenged the global food system, and many of us have discussed this throughout the year about how the impacts of COVID-19 have caused massive and large food insecurity in many parts of the world. But we also discussed and talked a lot about how our diet choices and how the way we grow our food also impacts and contributes to the emergence of pandemics such as COVID-19. Today, we want to further discuss the present lesson that we learned this year and also try to envision how our food system should look like in the years to come in order to provide healthy and sustainable food for all of us. Today, we have three distinguished experts that will help us and guide us and give us insights into how they perceive the future of the global food system based on their experience and the year that has just passed. I will present each one of the speakers before her talk. We'll start with Professor Marion Nestle. Professor Marion Nestle doesn't really need an introduction to the audience in Israel. When she was here 4 years ago, the tickets were finished within a day of her arrival when people knew she was coming. And the hall was really packed when she was over. She's a professor of nutrition, food and public health at NYU. She's author of several award-winning books related to food politics and so many other important subjects related to food. Her famous food politics blog is a beacon to many of us in the food movement. And we're really, really excited to have her with us again, Marion. Go ahead, the floor is yours.
Thank you. I just wish I could be with you in person. I've got slides and I'm going to have to go through the business about how to share them. Are you able to see this? Why am I not?
We'll help you through this.
Are you able to see that?
Not yet.
Not yet. Okay. I'm not seeing.
So you just want to hit share screen.
I'm a technophobe. I think I've got it now. How's that? Better? Better.
Yes.
Great. Well, thank you very much for inviting me to this, and thank you, Ellen, for the introduction. As Ellen mentioned, I write books about food politics, lots of books about food politics. And the most recent one, if I can get this to move, and I'm not able to. For some reason or other, I'm not able to move my slides. Is there any way that I can get help with that?
I think if you hit the right arrow, it should work.
Yeah.
I'm hitting the arrow on my computer and I can't, for some reason or other, I'm not able to move them.
Maybe make sure that you highlight the screen before you press the arrow to the right.
Perfect. Good. Thank you. We'll try that. I'm going to start out with a commercial. This is my most recent book. It's called Let's Ask Marion, What You Need to Know About the Politics of Food, Nutrition, and Health. And I wrote it in conjunction with a friend of mine, Carrie Truman. It's a very unusual book for me. For one thing, it's really short and it's very small, and it was meant to be read by anybody who's interested in food topics, including 2-year-olds, apparently. We finished writing the book before the pandemic hit, and in April, when I was doing the last set of reviews of the page proofs, I was able to insert a little bit about it and put in a comment that in experiencing the contradictions and inequities of profit-driven economic, healthcare, and food systems, this global pandemic illustrated the themes of our book. And the main themes of the book are that the food system is flawed, food is political, and advocacy is absolutely essential if we're going to have a better food system. Much has been written about the role of the pandemic in food systems and about how big food is undermining public health. But I think that the pandemic has revealed quite a lot about the food systems, how important diet is in health, how important social and economic determinants of health are, flaws in the supply chains, the absolutely astonishing plight of low-wage workers, the power of corporations to get what they want, regardless of health impact, the politics of hunger, and the agenda for advocacy. And I'm going to talk about the situation from what I've observed in the United States over the past 9 months. The first thing that happened was that it was obvious that people who had diet-related chronic diseases were at much higher risk of bad outcomes from getting COVID-19. People with hypertension, obesity, diabetes, cardiovascular disease, all of them diet-related conditions. So that the idea that diet is important to health was just emphasized by COVID-19. The socioeconomic factors were critically important. The chart on the left is a diagram of New York boroughs by income and the amount of COVID-19 cases by income. And as the income went up in Manhattan as compared to the Bronx, the number of cases went down. And that's what's shown there. And also enormous racial and ethnic disparities, so that the cases among Blacks and Latinos were much, much higher than among white people. Again, an example of socioeconomic determinants of health. Race in itself is not a risk factor, but the economics that go along with race have a great deal to do with it. And then exposure of the fragility of the food system. The first thing that happened was that grocery stores were empty. And this surprised everybody because there's plenty of food in the United States. We hadn't run out of food. But the pandemic made it obvious that in the United States, we have two completely separate supply chains. One for grocery stores, supermarkets, and other retail establishments, and a completely separate one for food service establishments. Different suppliers, different farms, different ways of distributing it, and they could not immediately supply for each other when food service shut down and there were no restaurants and there were no institutions that were serving food. That food had to be thrown away. It had to be wasted because it could not be transferred into the other system. And the result of that was this irony demonstrated in one tweet by Jose Andres, a chef in the United States who was just doing amazing things about feeding people who were in need. People of America, he said. Two photographs are telling the story of what's going on. One is this enormous pile of potatoes that's being thrown away because the food service people who were going to take those potatoes had no place to send them. At the same time that cars were lined up for miles to get distributions from food banks. One of the great ironies of the pandemic. Another great irony is what happened to low-wage workers. As there was a big push to keep the meat supply going, meatpacking plants became COVID-19 hotspots with enormous numbers of worker illnesses. And it's understandable why the workers would get sick. They're piled on top of each other, working shoulder to shoulder under very difficult conditions. They weren't masked. They weren't maintaining social distance, and the contagion among them was just enormous. So that by the beginning of December, Leah Douglas, who writes for the Food and Environment Reporting Network, and who is, as far as I can tell, the only person who is keeping score on COVID cases among meatpacking, farm, and food processing workers, reports nearly 77,000 cases among these workers, and so far 347 deaths. And these are just the ones that are recorded. And we know that all of this is greatly underreported. These workers are working in big beef, big meat. The cases are occurring in companies, in places run by Tyson's Foods, Smithfield, JBS, and other of the big meat companies. And this is a very concentrated industry where the 4 top US beef companies control 80% of the meat production and meat packing, and the top 4 pork producers control 66%. These are highly concentrated industries, which means that they get to call the shots. These are monopolies. They get to call the shots. And this showed up again, ironically, in an issue of the Washington Post, where on one page, there was a full-page article about how workers in these meatpacking plants were complaining about how they were being forced to show up for work, even if they were sick and not given masks and not kept at distance, at the same time that Tyson's had a full-page ad saying, we're being forced to close our plants and you're not going to get any meat. And this is going to be terrible for the American food supply. As a result, President Trump invoked the Defense Production Act not to protect the workers, but instead to force the meat plants to stay open. And there is now substantial evidence from investigative reports that the meatpacking industry drafted that particular executive order and handed it to him to sign, and that the Department of Agriculture, government, and the meatpacking industry collaborated to fight public health efforts in to protect meatpacking workers. Additional investigative reports revealed chaos as the meatpacking companies fought public health agencies. Anytime a state or local community wanted to close the plant to protect the workers, they were being forced to stay open. And Tyson Foods were discovered through these emails that had been obtained through court cases that they had money pools on how many workers would get sick in their plants. They had bets on the number of workers that would get sick. I can't think of anything more callous or less humane than saying, we're not going to try to protect our workers. We're going to try to make a little money off of guessing how many of them become sick. The meat industry also gave a lot of money to the campaigns of officials who were trying to, who were dealing with these lawsuits in order to keep the lawsuits under control and stop the lawsuits from being put forward. And the Occupational Safety and Health Administration, which is the agency of government that is supposed to protect workers, pressed the courts to dismiss the complaints of the workers against the meat packers. So what you saw was a collaboration between the meat industry, government agencies to keep the workers on the line, no matter how sick they were getting and no matter how much COVID they were transmitting. The OSHA, this Occupational and Safety Agency, did fine JBS and ConAgra and an Iowa beef plant for not keeping the workers safe. But these are companies that make $50 billion a year in sales, and JBS and ConAgra were fined $13,000, and this Iowa beef plant was fined under $1,000, a slight tap on the wrist, not even a slap on the wrist. So that's what happened with the low-income workers. And on the other side of that equation was what was happening to poverty in the United States. New York Times Magazine had a cover of another enormous lineup of cars waiting for handouts at food banks. And it was understandable why people were waiting for handouts at food banks. In July, 30 million Americans were reporting not having enough food on the table, and that was because they were out of work. The jobless claims have continued since their high in March and April, but there is still 1 million people filing claims for unemployment insurance every week, with stark racial disparities, again, because of socioeconomic factors, among people who who don't have enough food and are trying to put food on the table. The projected rates of food insecurity for 2020 are that 1 in every 6 Americans will be food insecure, not having a regular supply of food, not being able to count on having food on the table the next day, and 1 in 4 children. 17 million children are living in families that are considered to be food insecure. And that's just the ones we know about. It's not others. So it isn't too surprising that there were enormous increases in applications to the Supplemental Nutrition Assistance Program, the food stamp program, which is the one remaining piece of the social safety net that still functions. It's an entitlement. If you can qualify for it on financial grounds, you are entitled to get this program. And there have been the number of people enrolled in it has increased by millions since the pandemic started. And this too is ironic because the Trump administration over the last 4 years has been doing everything it possibly can to decrease enrollments in SNAP. It introduced work requirements. It introduced a public charge requirement, which is a law that says that immigrants who are not citizens who are using public assistance programs may lose their ability to apply for citizenship. And it has attempted to replace food stamps, which actually come in the form of an electronic benefit card that can be used as a charge card at any supermarket. The Trump administration has tried to replace that with boxes of food that are handed out and that you wait online for. So the work requirement business has been stopped by the courts, at least until the pandemic ends. The public charge requirement has also been blocked by the courts, but it has already resulted in large numbers of immigrants dropping out of this food assistance program because of their fears that if they stay on the program, they will risk deportation. I want to say a little bit about the food box program because it makes me crazy and I get really upset about it every time I talk about it. It seems like such a wrong program to be doing at this particular time, especially. The way that the food box program was supposed to work was that distributors would collect unused and unsold farm surplus and collect all that, put it in boxes, and then give it to food banks, private food banks, not government, private food banks, to be distributed to families in their area. How it worked in practice was just as you might expect if you think about the logistics of something like this. For one thing, it didn't get to small farmers. It only got to big farmers. The boxes were expensive and didn't work very well and didn't get to people who needed. The people who were profiting off of them were the distributors. And there's now a lawsuit that Black farmers say that they were cut out of the program. Small fruit and vegetable growers were cut out of the program. This ended up being a program, $4.5 billion that supported big agriculture. So it isn't too surprising that the press is now reporting that more and more Americans are stealing to survive on food. They're shoplifting. Stores are having enormous problems with shoplifting of food, shades of Victor Hugo and Les Miserables. I mean, we haven't seen that for just centuries. Or as one commentator put it in the New York Times, what we're seeing is the government supporting programs of free produce with a side order of shaming instead of putting everybody on the supplemental nutrition assistance program where they could go to grocery stores and buy whatever they needed. The government has opted for a return to something that we have not seen since the 1930s in the United States, which is these long food lines at food banks in New York, waiting online with shopping carts, and in rural areas, waiting online in cars. So my question in general is, can anything good come out of the COVID-19 pandemic? I tend to be a glass half full person, and I like to look for signs of optimism. And I think that one sign is how public these issues have become in a way that they never were before. The idea that extremely poorly paid food delivery workers who don't have health insurance, who don't have sick leave, are heroes in the United States right now is something that lots and lots of people recognize. The plight of low-wage workers in general, something that nobody in America was aware of, except for people who study these things. This has now become public knowledge in a way that it never was before. And we can hope that this is going to translate into better policy under the new administration. People are eating better in the United States, or at least some people are eating better. At the beginning of the summer, you couldn't buy seeds to grow vegetables because everybody was planting more vegetable gardens. And at the end of the summer, you couldn't buy a canning jar for putting up the produce that was produced over the summer. So that was, at least for people who have gardens, they're eating better. And there are claims that people are that COVID-19 has made millions of people healthier, yes, but it's also made lots of other millions of people unhealthier because they're eating more junk food and gaining weight while they're stuck at home. The pandemic has had an interesting effect on the food industry. And there are now reports that are written on how food companies can take advantage of COVID-19 to sell products. And I thought I would just show you one example, which is how Coca-Cola is taking advantage of the COVID-19 pandemic and putting out special bottles for educators, doctors, and so forth. Something that a lot of us raise eyebrows about. And there are reports on for retailers or how to navigate their way out of the COVID twilight zone. This was a report that came out just last week. And what's interesting about it is that it's in Forbes magazine, a business magazine, and this is a business commentator who was telling food companies that if they want to survive COVID-19, they must adapt to permanent changes that are driven by concerns about health and the environment. If the food industry is talking about these kinds of things, then it gives me hope that maybe it will have to change. And then there's Francis Moore Lapé's comment that to fix the food system, we have to do something about our democracy. People are hungry, not because they don't have food, but because they don't have any political power. And so that takes me to the question of how does the food movement get political power? And I think that's what we really have to be focusing on. That's what I'm teaching students in my classes. That's what I'm talking about everywhere I go, is how the food movement can achieve greater political power. And for that, I think we need to organize. We need to do community-based advocacy work. We have to be out into communities talking about these issues one-on-one if necessary, in order to build a bigger movement to get the kind of food system that we need, which is one that promotes health and promotes environmental sustainability. And so I'll end here with my mantra on this, which is that we all need to be voting with our forks for the kinds of food systems that we want, but it's not enough to exercise personal responsibility. We need to be out there doing food politics as well. And this is the kind of thing I'm writing about in my books these days and speaking about. And I'm very, very happy to have had the chance to share these thoughts with you. Thank you.
Thank you very much, Marion. We have let's see if we have some people. Let's see if we have people that want to ask questions. If anyone wants to ask questions, please put them on the chat and we'll try to address them. See, people are writing it down now. Maybe until questions start coming, maybe I will question your hopes for the new administration in terms of learning and actually doing something goes beyond the regular kind of things. I know that there's been a lot of discourse about how far the Biden administration is going to take these lessons. And also the recent, I would say, the appointment of the Ministry of Agriculture, the Agriculture Secretary. How do you think those would kind of take the things that you mentioned here and implement them?
Well, we don't know yet. A lot depends, bizarrely, on the senatorial election in Georgia, which is underway, because if the Senate is dominated by Republicans and the Republicans continue to behave the same way they did under Trump and under Obama, in the Obama administration, they will be trying to block anything that the new president does that is even reasonably progressive. So a lot depends on that. The appointment of Tom Vilsack as Secretary of Agriculture was an interesting one because he was Secretary of Agriculture under Obama. And so we know a lot about him. We know what he did well and we know what he did not do well. And the appointment has been extremely controversial because people who care about the kinds of issues that I just talked about and that we're talking about in this seminar did not get the candidate that they wanted. A candidate who was committed to these kinds of issues. Instead, we got a candidate who has a record of favoring big agriculture, is not interested in small agriculture, is not interested in doing anything about the inability of Black farmers to own land, has no record of really caring about these kinds of issues. I mean, just he is interested in climate change, and that's a good thing. But I got to give him a chance to see what he can do, and what he will be able to do will unfortunately be dependent on what the composition of the Senate is. So I mean, so it's hard to know.
Yeah. Thank you. Two more questions. First one, what is the first step to citizen involvement in the food sector? So I think you mentioned some, but some of that, the first step to citizen involvement in the food sector.
Yeah, I think you have to join organizations and start using the political system. And when I get asked that question, which I get asked all the time in every talk I give, how do I get started? I say, find an organization that's working on issues that you care about and support it in some way. Join it. Use the political system as citizens in America are able to use the political system, which is to write to congressional representatives, meet with congressional representatives, and try to get their views known. Advocacy has rules. Just like anything else, there's a literature on how to do advocacy, and I think everybody ought to be reading that literature because there are guidelines about how effective advocacy works. You have to have a very clear goal. You have to organize people to support your efforts to meet that goal and to work out strategies and tactics. You need lots and lots and lots of people who are united behind the strategies and tactics and the goal, and who are willing to take action to achieve it. And in order to do that, I think you need to do community organizing. I want to see our students out in the communities talking to people about these issues and trying to get them lined up. And we do have examples in the United States of extremely successful food advocacy around soda taxes in certain cities in the United States, particularly Berkeley, where the approach that was used was a community organizing approach, and it was astonishingly successful. The Berkeley Soda Tax passed with a vote of 76%. That's unheard of in American elections. 76%, we're lucky if we get 51-49 on most of them. So there was widespread community support for it because the people who did the advocacy were community organizers and went door to door talking to people and had an enormous buy-in by the time the tax was passed. Even though the people who were voting for it were people who were going to be hurt by it if they continued to buy sodas. So it can work, and I think we need to do more of that.
Thank you. Last question, is the food bag still in effect today, or will that just out with the new administration?
The food boxes are supposed to go until December 31st, the end of this month, but in fact, they've run out of money. So it's very unlikely that the Trump administration at this point is going to put more money into them. And the food banks are complaining that they don't have the boxes. And in fact, there was an article in the local paper or in the town where I'm living right now this morning that said that the demand on food banks has increased by almost 50%. And they're barely able to keep up with the demand. They just can't. The food banks are private, and that's not policy. That's private charity. It cannot possibly keep up with the demand. It cannot possibly provide people with the food that they need at the quality that they need. It's the wrong policy.
Thank you very much, Marion. Thank you very much. We're gonna
My pleasure.
We're gonna move to the next speaker, Professor Chris Golden from Harvard University, the Department of Nutrition. Chris is an ecologist and epidemiologist studying planetary health, focusing on biodiversity, climate change, and habitat change, and how all of that affects human health. His research spans locations in the world, and this one dates back to decades ago in Madagascar. And the floor is yours, Chris. Thank you very much.
Thank you so much, Alon, and good afternoon or good evening, everyone. I want to thank you for the opportunity to be able to present this body of research, and I've had the enormous pleasure of working with Alon for the past few years, and I'm really excited about my collaboration with him kind of extending through his transition to Tel Aviv University. Planetary health as a field explores the human health impacts of global environmental change. So whether it's focusing on climate change, biodiversity loss, land use change like urbanization, fisheries declines, agricultural land conversion. All of these forms of environmental transformations have downstream effects on human health. And the World Health Organization estimates that roughly 1/4 of the entire global burden of disease could be avoided through improved ecosystem and natural resource management. And so this to me really provides an interesting entry point and provides hope that we could actually create solutions that kind of co-develop intersections and integration across the environment and public health. So Alon has tasked me with speaking directly about aquatic food production and the role of aquatic foods in healthy and sustainable diets. And so I want to kind of walk you through the pathway of this presentation where we think about the declines in aquatic food catch and catch potential and what that will do to the world and how that will position certain populations across the globe to be subject to various forms of nutritional vulnerability. And so to start, when thinking about the declines in fish catch globally, harnessing data from the Sea Around Us project, we actually were able to use fish catch estimates beginning in 1950 all the way to the present, and looking at the ways in which this was disaggregated across various sectors, whether it was industrial, artisanal, recreational, or subsistence. And you can see the area in the deeper red, which shows that there will be massive declines in fish catch projected out by end of century. And so what we are really thinking about what will occur is that there will be massive changes in the availability of seafood across the entire world. It will increase ocean acidification, increase sea temperatures, and move fish populations from the equator toward the poles. And as a public health specialist, what I see is really a kind of red highlighting of areas where the food security and nutrition is the worst, where we struggle with ocean governance, where plans for climate adaptation are least developed, and where there's really a looming food crisis. So what types of foods will people then move into if seafood becomes less available? My basic answer to that is that no matter which food is substituted, it will almost always be nutritionally inferior to seafood. And what I want to emphasize is that seafood is really well positioned from a micronutrient, vitamin, and fatty acid standpoint to really deliver nutrients in an easy and delicious way. And by no means am I trying to suggest that vegetarian or vegan diets are a bad thing or a negative thing, but when you look at global diets and you look at the role of infectious disease and food supplies in a global context, very often a vegetarian diet is something that is a luxury of the West and the kind of global North to be able to provide nutrients in an adequate and sufficient way, given the structure of food systems. And so we need to think about this in a more kind of holistic and equitable programming of how to incorporate and integrate at least moderate amounts of animal source foods into the diet from a global perspective. So what types of dietary changes will that lead to? Basically, I see that there will be three typologies of nutritional impacts when we look at seafood declines globally. There will be the wealthy, unaffected nations, and so that will be places like the US, South Korea, New Zealand, where there might be a local collapse of seafood, but then there might be slight price shifts in the market, there might be some species shifts, but for all intents and purposes, people who were eating seafood beforehand will continue, and people who were not eating seafood before will continue not to. There will also be countries where you will have increasing undernutrition. These will be places like Madagascar, Gabon, Suriname, where you have a local collapse of seafood and people will move into more roots and tubers, more veg, and not be able to really get that kind of high pack of micronutrients that's needed for their nutrition. And then interestingly, we have this third typology, this case of acceleration of nutrition transition. This would be places like Indonesia, Mexico, Brazil, small island developing states of the Pacific, where you have a collapse of the local seafood. And then people are moving into cheap and easily accessible market-based food items, which are incredibly energy dense and will lead to greater rates of metabolic disease. Of course, I am glossing over a lot of complexity and nuances, but just to frame out kind of three possible trajectories. And so where will this create nutritional vulnerability? What we published here was actually a figure where we wanted to try to identify where in the deep blue in the ocean would have the largest catch declines by mid-century, and the countries in orange where you would have the highest reliance and greatest nutritional vulnerability. And so where these two colors meet in West Africa and Southeast Asia and small island developing states in the Pacific is really the intersection of where we see this looming food crisis and hotspots of nutritional vulnerability. And so how do we fix this? There are different ways to fix this, and Marion talked about really powerful and important ways of becoming activated as citizens, of activated as communities, of really engaging with policy and policymakers. And we also need to directly engage with the environmental sector, with the food sectors and innovation of both fisheries management, aquaculture, and a variety of other sectors as well. And so what we anticipate is that we have really experienced in recent times an unusual situation where wild capture fisheries production has declined and aquaculture production has sharply increased. And really what this has done has been to delay this ongoing crisis. So we see that there has been more and more aquaculture production, more and more people that have access to aquatic foods, and yet it is still insufficient. And the people who are eating aquaculture products are fundamentally different from the people who are eating wild capture fisheries products. And the very nature of it is that wild capture fisheries actually feed aquaculture production. And so in general, there might be inequities that are embedded within this food production system that take food or different types of fish away from the global south or from nutritionally vulnerable people and process it and package it in such a way that it then becomes aquaculture products or luxury products that then is sent to the global north. And so there are interesting dynamics that are kind of embedded within this system. it is important to focus on these inequalities and on these inequities within the food system. And so what we've done here is really to look at the way that aquaculture is produced, focusing on the 40 most nutritionally vulnerable nations on Earth that are also reliant on aquatic food products. In the red, you have countries that produce little or no aquaculture, so they are expected really not to benefit from aquaculture production at all. The way that the market works is that food products are not flowing to Libya and Mauritania in the way that the global kind of food market works. In countries in yellow, you have a high amount of aquaculture production, but it's nearly entirely export oriented. So in Madagascar, Peru, Chile, all of this production is then destined for other countries to nutritionally benefit. And the money that is generated is all coming from very large aquaculture production companies. And so people will not even indirectly benefit from these income generating activities. The countries in green are where a lot of aquaculture is being produced and it is being retained domestically. So these are countries where it is hopeful for it to benefit local populations, and yet there are still many examples of where it is being concentrated within wealthier households, within megacities. And so really you need focused, nutrition-sensitive aquaculture programming that is gender sensitive, climate sensitive, and really oriented to benefit people from the outset in order to have this type of production really prevent these types of nutritional inadequacies. And so you do see bright spots of this in places like Bangladesh and Cambodia, where you have joint rice fish cropping systems and farming systems that have been designed that way from the outset. Another paper, just to embarrass him right now, is one that Alon recently published. And the last slide that I presented really diagnosed the problem. This slide and this paper really identify a potential solution where we can have aquaculture production that is oriented both to environmental sustainability and to nutrition sensitivity. And so what Alon did here was created an optimized solution using life cycle assessment data and using nutritional data to say, okay, in the case of Bangladesh, this is what the food system looks like. Here are what the nutritional inadequacies are. So what type of aquatic foods should be produced that have a nutrient composition that could supply these types of nutrients while minimizing the environmental footprint? And in doing that calculation, it created a potential pathway for the country of Bangladesh to enhance its nutrition security while minimizing its environmental footprint. And so ultimately what our goal should be is to really orient aquaculture and fisheries management systems so that they can increase fish catch, strengthen resilient food systems, create positive dietary change, and really end up with nutritional security. And so I'm going to switch gears a little bit now. We've talked about how sea temperature rise can drive all of this at a global scale. That's not the only issue. The other issue is that climate change is also affecting the very quality of the foods that we're eating. There are projected declines in global DHA, a type of fatty acid, that would be available for human consumption as a result of global warming. And so not only understanding the impacts on how climate change is affecting the availability and access of foods, but what is it actually doing to the underlying food system as well, and what it is doing to the content of our crops, of our seafood, et cetera. Additionally, at more local scales, what I want to do now is kind of move into particular regional case studies of how this could affect the food system through coral bleaching or through ocean acidification, and how reef-based food systems in particular cultural contexts are really incredibly important to the food system and to people's nutrition. And so what you can see here is that the nutrition transition was recognized as a global crisis in the mid-1990s. It is marked by a shift to Western diets, high caloric, high energy foods. And as countries move along this development spectrum, their risk of underweight goes down and their risk of overweight increases. And 9 of the 10 most obese nations on Earth can be found in the small island developing states of the Pacific. And so really from a regional standpoint, this area becomes quite important from what will happen to seafood at global levels. You can also see that these countries are heavily reliant on seafood in the first place. I've been doing work in Kiribati for the past few years. You can see that their annual fish consumption is quite high, with around 115 kilograms of fish being consumed at annual levels. And so this entire region is heavily reliant on this very fragile food resource in the context of what climate change will do to it. When aquatic foods move out of the system, the risk here in the Pacific is that what they then rely on in the absence of having agricultural production systems, and as Marion discussed, kind of particularly in this context of COVID-19, and what is able to be stored, what is able to be shipped, and how these supply chains really influence the diet. They're moving into mutton flaps, turkey tails, Spam, tinned corned beef, ramen, and all of these products really constitute an incredibly unhealthy overall diet. In addition to the key roles that seafood plays in providing critical micronutrients, protein, vitamins, and fatty acids, particularly to people in the global south, at a global level, seafood also plays a significant role in avoiding metabolic diseases. This impact is really delivered through two mechanisms. One is that seafood provides omega-3 fatty acids, which have been shown to improve eye health, brain function, and reduce the incidence of heart disease and certain types of cancers, anxiety, and depression. And then secondly, seafood displaces certain types of unhealthy meats, ones where the fats of red meat and processed meat really lead to a variety of different types of all-cause mortality. And so what we moved into, and what Alone has become a really core partner in and critical component of, is this Blue Food Assessment. This is in partnership, or was a kind of direct result of the recently released Eat Lancet Commission report on healthy and sustainable diets. And that report really highlighted this tension between providing adequate food for the global population while not exceeding planetary boundaries. And so as a follow-up to that, the Stockholm Resilience Center and the Stanford Center for Ocean Solutions, in support by the Eat Forum and Springer Nature, have launched the Blue Foods Assessment. And this assessment was really done to identify and highlight the important role of aquatic foods in healthy and sustainable diets, and also to really create synergies between terrestrial and aquatic food production systems. So often we see these things as isolated and independent, but really they are so inextricably woven together that we can't think of them in isolation. And so really in this way, food systems represent an emblematic social ecological system where both cultivated and wild foods are directly reliant on natural resources. We can't underestimate the degree to which food systems are so tied to the health of the underlying environment and natural resources that allow us to produce food. And mediating between food production and nutritional security, there are myriad governance and institutional structures that create pathways for people to access food. And specifically what I want to argue in the rest of this presentation is that there are feedback between these coupled social and natural systems that reinforce each other and can create a social ecological trap whereby the more and more that we degrade healthy environments, the more and more likely we are to end up with poor nutritional and health outcomes. And so to highlight this in kind of the most visible way for me, for someone who has been living in Madagascar on and off for the past 20 years, for someone who's been working now in Kiribati for the past 5 years, was to focus on what we're doing to coral reefs and how this impacts diets. And so here I'm really presenting the case of reef-based food systems to showcase global patterns of entrenched social ecological traps and how this leads to the acceleration of the nutrition transition. And as I've mentioned, I've been working in Madagascar and Kiribati and these other places, which really help to fertilize these types of ideas of how this works. In 2018, a group of us received a National Science Foundation grant to begin studying this in earnest. And so I want to acknowledge some of my partners on that, Jessica Gephardt, Katie Cito, Jacob Urich, Doug McCauley, who have really created kind of co-ownership of these ideas. We hypothesize that healthy reefs are necessary to ensure the continued benefits of coral reef food production to nutritional health. And whether or not a reef system is able to produce those types of healthy benefits depends on the governance system. Are we managing coral reefs and the kind of ocean environment in such a way that will allow us to yield benefits from access to traditional foods and traditional seafoods? Coral reefs are the most biologically diverse marine ecosystem and are deteriorating in many locations as a consequence of human activities. So climate change, overfishing, land use changes, so the more and more deforestation, sediments can flow into rivers and into coral reefs. And lastly, disease outbreaks, so things like ciguatera, things like harmful algal blooms can all really damage the ability for coral reefs to provide local people with food. And all of these impacts, regardless of driver, reshape people's relationship with the reef and lead to changes in people's access to seafood. In addition to this, there are not only kind of natural ecosystem transformations, there are cultural and social transformations occurring as well, along with kind of new income opportunities and population centers. And this can drive away or shift traditional reliance on fisheries as a food sector. Nearly half of all Pacific Island countries and territories have more than 50% of their population located within an urban center. And in recent decades, many of these small subsistence communities have begun to shift away from fisheries livelihoods and move into more sedentary work. And so this is, again, not going to yield the types of benefits that we need from these natural ecosystems. Cash-based economies, trade liberalization, all of this has reduced barriers to food trade with a goal of lowering food prices, increasing the diversity of available products, and increasing market access. And yet this has played out in really perverse ways globally, and perhaps even in the most perverse ways in the Pacific. And I think that this poem by Kathy Jetnil-Kijiner from the Marshall Islands really highlights that, how people have become reliant on these things like Vienna sausages and Spam and tin corned beef and moved away from their traditional diets, which had provided really a healthy mainstay for them historically. And so just to return you to this kind of visualized framework and kind of the dietary and nutritional outcomes that can arise, what we see here, if we categorize all of these countries that rely on coral reefs for food, is each one of these now represents a dot within these 4 quadrants. And the social ecological food system produces these entrenched categories for 4 different nutritional outcomes. In this figure, we've obviously erased all complexity and nuance to simplify and illustrate these nutritional archetypes resulting from reef-based social ecological food systems. And we have reef catch on the x-axis, which can really be seen as the intersection of the health of the environment and the quality of governance in being able to yield seafood or aquatic foods from the reef. And on the y-axis, we have the import dependency ratio, which really highlights kind of to what extent people are reliant to a globalized food system in the absence of being able to produce their own food. Each of these 4 quadrants then has its own identity. The traditional diet in the lower right consists of high seafood consumption and low consumption of Western food items. The mixed diet in the upper right depends on preferences, culture, and prices, with many potential outcomes depending on really the contexts of each of those categories. The undernourishing diet in the lower left shows what happens when traditional food sources are no longer sufficiently available and people lack access to market alternatives. And finally, the overnourishing diet in the upper left highlights a replacement of traditional foods and assumes that the market is providing these kind of unhealthy substitutes, which is not an unfair assumption in many of the places that we are considering. So chronologically, diets can be thought to begin in the lower right and then either move to the lower left into the undernourishing diet as ecosystems degrade, or as markets globalize and market integration occurs, you could then move up and then to the left into the overnourishing diet. And you kind of see this relationship between development unfolding, environmental transitions that are happening around the world, market transitioning that happens around the world, and how all of those things intersect to really shape our food system, shape our diets, shape our nutritional health, and then shape the health of our entire population. And so where do we go from here? Rather than focusing on either the potential to promote ecological outcomes at the expense of nutritional outcomes, or vice versa, what I really want to suggest is that by specifically focusing on the social ecological dynamics themselves, we could potentially find solutions that promote social ecological health. And that's really how we need to be considering this. Governance interventions that prioritize local food security and nutrition over revenue generation may produce co-benefits by increasing local food access while simultaneously reducing profit-oriented overexploitation of reef fisheries. So this kind of support for rules and authority over centralized government regulations and institutions has the potential to really improve responsivity to both local nutritional needs and also to avoid potential declines in reef health. To better coordinate nutrition and trade policies, some countries are even going as far as establishing agencies that bridge health and trade policies, such as Thailand's International Trade and Health Program. And I think this provides a really interesting example of how we really need to not consider these things in silos. We need to integrate trade and markets and food and nutrition and health into one conversation. And while trade-offs certainly exist between social and environmental management objectives, oftentimes the interventions that seek to promote local access to seafood resources and healthy environments simultaneously promote nutrition and overall environmental health. And with that, just wanted to thank all of my collaborators. There's a lot of people who are not listed here, and also the funding sources that I've been grateful enough to work with. Thank you.
Thank you much, Chris. Thank you. It was very, very interesting. Even though I know much of your work, there were a lot of things that were really new to me. Thanks so much. Let's see if there's some people in the audience that want questions before I start. Wait a second. Let's see. Maybe I can start asking a question. So the next step now is, after we had the Eat Lancet, and now we have sort of the Blue Food Asset actually tries to look at culture and capture fisheries in one holistic view. Maybe the next step afterwards is trying to integrate both of them. And because they have been working in sort of silos and unconnected. Maybe the next step is integrating all of that into one unified understanding.
That's exactly right. And I think that we've been doing that so far. So we're working directly with the Food and Agriculture Organization and other kind of UN member organizations. And so we will have actually a database that covers both terrestrial and aquatic foods within the Blue Food Assessment. So our report should actually highlight the integration between both.
Okay, let me see if there is questions.
I'm seeing one. Are there any recommendations for the private consumer? I think that's a really, I think that's a great question. And I think that this depends so much on what you care about. I think Marion might have a different answer for this, but I will share my perspective, which is that there are so many ways to measure and assess food. There are nutritional considerations. There is a climate footprint. There's a freshwater footprint. There is organic versus non-organic. There is local versus non-local. There is fair trade versus non-fair trade. There are so many things that you can look at with regard to food, and it's impossible to maximize all of those. And so really at the end of the day, it becomes a decision about what you care about most and minimizing some of the risks and dangers that can be associated with certain types of diets. And so I think becoming a well-educated consumer is critically important. With regards to things that are kind of seafood related, things that I take kind of into consideration in my own diet is I try to avoid things like shrimp from Southeast Asia. These are things that are known to have a ton of kind of antibiotics that are poured into their production systems. They have also been implicated in child slavery. And so for a variety of kind of both environmental and social reasons, I kind of decide to steer clear from that. Red meat is clearly at the top of the list when thinking about things that are not really nutritionally beneficial in the context of their enormous environmental footprint. But each of these things will slightly depend based on the cultural and geographical context from where you come. And so where I've lived in Madagascar for 20 years, I would never suggest that people stop eating red meat. They eat very, very little red meat on an annual basis. They might have maybe 1 to 2 kilograms a year for many of the people that I live with. And they're all kind of produced in such a way that are modestly sustainable. So I think it really depends on the context from where you're coming.
Thank you. It's really, see if there's more questions. Are there any successful commercial aquaponic farms? Someone asked. Do you know any of that?
So I unfortunately am not an expert in terms of aquaculture innovation. That is certainly kind of an area where a lot of people are moving. And I think that right now we're kind of still in the Wild West, for lack of a better term that is internationally resonating, but it is still a very unregulated industry. And so what we really need to do is to create different types of aquaculture production systems that are sustainable, that are kind of healthy for the planet, while at the same time producing products that are accessible to low-income consumers so that we can have the most nutritionally vulnerable people benefit. When it comes to aquaponic farms, I apologize. I'm just not an expert in that.
Thank you very much, Chris. Thank you.
And there's a question from Tamar. So I guess, are any big biz on board to give monetary resources? I think that there are lots of people that are moving in this direction, lots of companies that are moving in this direction. I think at the end of the day, money is always the kind of key term for them. And so the feed that goes into aquaculture production will follow whatever the prices signal. There are some companies that are trying to do better. So Cargill, as an example, is kind of actively creating grant money to create research for aquaculture feeds that are plant-based entirely, while at the same time creating equivalent amounts of fatty acid profiles within their aquaculture products. So it is a direction that I'm hoping more and more businesses go into. Thank you, everyone.
Thank you, Chris. We're going to move to our last speaker, Dorit Adler. So Dorit Adler is a clinical dietitian, with an expertise in nutrition health and its relation to social issues. She's the former director of the Nutrition and Dietetic Department at Hadassah Hospital and is the head dietitian of the Israeli Council for Nutritional Security. She's currently also serves as the president of the Israeli Forum for Sustainable Nutrition. Dorit, thank you very much. The floor is yours.
Okay, I just need to share my screen. You see the screen?
Yes.
Okay, so it's a huge honor to give a talk after such two distinguished lecturers, and it's an honor to present the Israeli Forum for Sustainable Nutrition, the IFSN, activities in 2020, and the path towards sustainable food systems. I'll give a snapshot on the Israeli food system prior and during the COVID-19, summary of the IFSN 2020 activities, and the path towards sustainable food systems. This is a snapshot on the Israeli food systems prior and during the COVID-19. I'll begin with the fact that Israel supplies 3,800 kilocalories per person per day, way beyond what we really need. And this is a precursor to obesity on one side and the huge food waste on the other side. In Israel, 40 to 50% of the calories are being consumed by ultra-processed foods, 40% among adults and 50% among adolescents. Our obesity rate is 33% among adults, and when we look at overweight and obesity among women in the lower socioeconomic status, it reaches 70%. All this costs Israel, only the obesity problem, 9 billion shekels a year. The nutrition security is also a big problem in Israel, even though Israel is a rich country, not like the United States, but still is considered a rich country. We're not lacking food, and there is no reason at all to have nutrition insecurity. Prior to COVID, we had 18% of our population in a situation of nutrition insecurity. And today, the numbers are detected like 22.6%, but we believe it's higher. There are reports from soup kitchens and food banks or NGOs who really give food boxes that the people that are coming there have been doubled. Our diabetes rates are also quite high, with 9.6% among the middle and higher socioeconomic classes, and the low socioeconomic class, we have 25% of diabetes, which really reflects huge nutrition and health inequalities in Israel. Israel imports 80% of its calories, of these 3,800 calories. On the other hand, it grows most of its fresh fruit. That means there is a big discrepancy here. We import mainly grains, oils, and sugar, mostly the empty calories. On the other side, the consumption of fruits and vegetables are really alarming because it deteriorated from 206 kilograms per capita per year in 2001 to 138 kilograms per capita per year in 2019. It's the opposite direction for what happens in the leading countries in the world, I would say. This is accompanied by dramatic increase in the fruit and vegetables prices, which raised at that time by 38.5%, which is double the increase in the consumer prices index, which was only 19%. Today, fruits and vegetables are not affordable for the lower socioeconomic classes, but not only fruits and vegetables. The whole healthy food basket is not affordable for nearly 30% of the Israeli population. When I was a child, the lower socioeconomic classes, their basis of the food was fruits and vegetables that they bought in the markets. So our situation is actually deteriorating. And as in many other countries, we have a big problem of food waste, which reaches 2.5 million tons a year, which reflects 35% of the local production. And the estimation, it might be overestimation, but still the estimation is that it costs us 20 billion shekel a year. When we look at policy, of course, Israel is a modern country. We have many regulations around the food systems. However, we have very few regulations that promotes healthy, sustainable diet in Israel. We have very few parts of this puzzle which are weak and far from coping with the huge crisis ahead. Just for an example, I believe most of you know that Israel passed a reform that regulates the fact that the food industry needs to put the red symbol on ultra-processed food, mainly those rich in fat, sugar, and sodium. Last week, there was a report from the industry that not only that the consumption of this product did not reduce, some of these products, the consumption raised dramatically. So maybe it has to do with the COVID, with the lockdowns, we don't know, but it really reflects the fact that we need regulation that will cope with the dramatic crises that we are confronting now. What is the missing part in all this puzzle? It is a strategic master plan for the food system as leading national resilience and security commitment. I would like to share with you also a glimpse of the Israeli food sources from the independent agriculture production through imports and through the production which depends on imports. So if we look at the left graph, you can see in green the products that we produce 100%, actually over 100%, because we export a part of this production. And this includes potatoes and starches, fruits and vegetables. The Israeli agriculture produce all the needs of the Israeli population. On the other side, we have in yellow what Israel imports. And we can see that we import almost 100% of the sugar, most of the vegetable oil, and most of the cereals. About plant protein like legumes and nuts, Israel produces today 50% of the consumption, and very easily it can produce the whole 100% of our need with some incentives to the farmers. In red, we can see that Israel produces most of its milk, dairy, and animal protein consumption. However, it depends on the import of cereals and mainly vegetable oil. But I would like to take you to the right graph to show you that Israel today is leading in consumption of poultry in the world, and it's fourth in consumption of red meat. Why is this important? Because when we talk about sustainable diet, healthy and sustainable diet, we are looking to the Crete diet in 1960s. At that time, the consumption of meat and poultry together was 35 grams per day in average. The planetary diet of the Eat Lancet is recommending something between 45 to 50 grams a day on average. The Israelis are consuming nearly 200 grams of poultry and red meat a day, which is dramatic, way beyond any recommendation for healthy and sustainable diet. And just to mention that even though poultry is neutral in its influence on health, when we fry the poultry, it tends to be harming kind of food, and most of the Israelis consume the poultry as schnitzel, especially the chili. Why I'm mentioning this? Because when we look at the sustainable healthy diet, it recommends to cut down the consumption of these products, and Israel is in a place that it has to recommend it and to adopt a real reduction. First, in the for the target of our health, but also for the sustainability. If we do this, we will need much less of the cereals and the oils of what we import in order to feed our animals. So this hints that Israel, which actually is a kind of an island economy, can, especially for today, can produce most of the Mediterranean diet food basket. So we began this year with the launch of the Eat Lancet. It was mentioned by Tamar and also Alon, and we translated the materials to Hebrew in order to promote healthy, sustainable diet, prominently the Mediterranean diet, for the public, professional, policy leaders, and regulators. But then the COVID arrived and exposed the vulnerability of the food systems in Israel, like in many other countries, and accelerated the IFSM to act towards nutrition security to all. We began with policy proposal to attain food security in Israel during the COVID-19 pandemic, and we wrote a position statement in collaboration with the Israeli Association of Public Health Physicians, which we share many parts of our position statements and acts in the Knesset. And this paper called for immediate act to ensure sufficient supply of fresh and local production, assuring accessibility and affordability of healthy basic food basket to all, and providing healthy food to elderly and people with special needs, especially through lockdowns. It was obvious that there is a real danger that the lockdowns will prevent Israel from importing some of its food, even though it didn't really happen. But that doesn't mean it will not happen in the next crisis. So we are actually doing a lot of work of advocacy, as Marion stated before. And since then, since March, we wrote few position statements on food security policy for a prolonged state of emergency, a call for implementation of healthy food basket in a newly food stamp program, which was harshly, began, not yet implemented. We call to implement direct financial support for farmers, pre-custom lifting to strengthen the Israeli national food security, and position statement to label eggs and poultry packages for the risk of Salmonella and Campylobacter contamination. Something like this exists in the United States. In Israel, it does not exist. And now our poultry and egg will carry the green label as a food which is recommended for the Israeli to consume more, even though I've showed you that we're consuming so much more than really recommended. Another initiative that Alon actually is leading is the Edible Schoolyard Project at Mikveh Israel, which is a school, and it, envisioned by our network of chefs, has provided baskets of vegetables during the hardship of COVID-19, and it has been seen that it supports resilience and multifunctionality, because this garden has shifted from the educational resource to supply fresh vegetables and products. And the plans are to plant additional trees, which are currently underway. Another initiative, which is actually a continuous one, is truth in publication, especially in our fake area. It is a joint project of the IFSN and the Seventh Eye, an independent Israeli investigative magazine. The Truth in Publication critically examines advertising campaigns and media publications in the field of nutrition, the environment, and public health. As part of our collaboration, a series of articles have been published reviewing false advertising claims made by Tnuva and the Israeli Poultry Council, as well as sensationalist coverage of scientific papers. We see this act as one of very, very important one, in order to give the public possibility to get the real and evidence-based information about all the topics of the food system. All this action has made the IFSN is actually being addressed almost weekly by the different media channels as a trustable organization of experts in the different aspects of food systems, from all versions of diets that are coming every month through nutrition insecurity, agriculture, and food waste. And as you can see here, we presented in the Knesset, which is the Israeli parliament, 3 weeks ago, our position statement that any initiative to give food stamps to population has to focus on the healthy food basket, which also dictate not only what the basket will have inside, but what kind of food should not be included. We also, for 5 years already, have a monthly meeting that in each one of them we actually learn and research a topic, one topic of the food systems. So we began in February this year with the Eat Lancet Lounge. Then we had a few meetings considering the COVID-19, one with food security, and the other one, COVID-19 and zoonotic diseases, food systems, and the environment. And then after we were dealing with exploring policies to reduce the consumption of meat and dairy and food waste in the EU through nutritional and environmental aspects of edible fish and food choices in post-truth era, which was in November. We have strategic collaborations and catalyzing networkings on the critical issues of the food system. The first one of them is with the Steinhardt Museum of Natural History, Tel Aviv. And this is the place to say thank you very much to Professor Tamar Dayan and Alon Sapan. We think our collaboration is fruitful and really amazing for the future of the Israeli food systems. We have collaboration with the EAT organization, the Food System Dialogue Initiative, the Ministers of Health, Agriculture, Environment, etc., with Knesset member, which are the Israeli parliament as mentioned, the Public Health Physician Association, in the academia with the Hebrew University, Weizmann Institute, Tel Chai, and more, with the Tel Aviv municipality, and many, many NGOs like Life and Environment, Heschel Center for Sustainability, Salul, the Seventh Eye, PAN, and every week we get another request for collaborations. So where are we heading? Our big mission as we see it today is towards a master plan for the Israeli food systems and national strategy to food and nutrition security. We strive to consolidate a master plan for national nutrition security based on system dynamics, a method for analyzing and management of complicated systems as food systems are. This plan will offer a scientific, technological, and regulatory roadmap, first of its kind, to ensure food and nutrition security today and in the future. The plan will settle the needs of different stakeholders, will be accessible to the public in number of media channels, and be presented in chosen countries and organizations in the world. We have begun to work on such a plan, and we have an extraordinary researcher to lead it, who is Dr. Asaf Tzahor, that we are really proud that he joined the Israeli Forum for Sustainable Nutrition. Another compass that we are leading is the healthy food basket that should be promoted and implemented in all policies. We were of the group that initiated the concept of healthy food basket, but at that time we focused on the foods that should be included, which are the heart and basis of the healthy sustainable diet promotion in all policies. However, until now, there was no clear saying about the food that should be excluded from the basket of the healthy food in all policies. which mainly are the ultra-processed foods, and should be targeted in all policies for reduction from production through consumption and food waste. The Ministry of Health, I must mention, came out 2 or 3 weeks ago with such a recommendation aligned with our vision, that on the green side you can see the recommended food basket. On the orange you can see the food that should be excluded from any policy to support especially nutrition insecurity. I must mention that now in the Knesset there is initiative to give the food industry a 50% reduction on taxes if they donate food. However, most of the food donated by the food industry, as Marion knows and mentioned very in all the books and the blogs and everything, is harmful food. So we believe that we should not encourage the food industry to donate harmful food. Actually, we should prevent it by not giving any incentive the other way around. So what is the path towards sustainable food system? We believe in Israel, it is promoting the Mediterranean planetary diet in all activities and policies. The target for Israel should be the target for Israel's agriculture and national food security safety net, implementing the sustainable diet as a default diet among dietitians, physicians, and health professionals. We are far away from this situation. We need to change the industry impact on the nutrition quality and marketing burden. It's not a secret. This needs a lot of work and collaboration. We need to promote a holistic food culture based on the 4 dimensions of the Mediterranean diet and to tackle food waste around the food system. And to conclude, the IFSN targets forward. Nutrition security budget should be integrated to the basis of the state's budget permanently. I must mention that Israel do not have any program financed by the government like the SNAP program. Israel actually financed nearly 5% of the whole budget that is included in the nutrition support of people in nutrition insecurity, mostly by NGOs. We will develop a master plan for the Israeli food system within 2 years. Israeli farmers and agriculture will be considered as a national security assets, facing the climate and other crises ahead, legislation supporting it, promoting legislation to assure healthy and sustainable diet in all policies. Today, it's only fragmented and very, very weak policies that cannot confront the big crisis that we are in. We will promote advancing our networking with diverse organizations and partners to promote the resilience, healthy and sustainable food systems, and continue with our core activities. And for the first time, I mentioned that one of our missions is to raise budget to continue, because until now, for 5 years, this amazing staff is working voluntarily and doing an amazing work, which is being rooted and actually influence every part of the food system in Israel and a little bit even abroad. So thank you all from the Israeli Forum for Sustainable Nutrition.
Dorit, thank you very much. Thank you. Okay. Let me see if there's some questions for Dorit. Otherwise, I will start asking. I have many questions. I don't know, there is a question here that says, why is sugar in green?
Sugar
I think it's confused by the fact that it is actually imported. In your slide, in your bars, it was labeled as imports, and someone maybe thought that, I don't know, maybe did you refer to it as green in terms of healthy?
No. It's in yellow, and it's no, it's in yellow, I think. We are importing almost all of the sugar, and as you know, sugar is not contributing to our health.
Okay, any questions? I will start by asking the questions. Where do you see our major obstacles? If you have to take a full system approach of looking at things, where do you see as the major hurdles, obstacles in achieving our goals? Where will you tackle them when you think about a sustainable food system in Israel?
First of all, we have problems of governance now, which really makes it difficult to promote legislations. It is an obstacle in any part of the world, anytime, because we are confronting huge forces. And until now, nobody really succeeded to create a really healthy and sustainable food systems. However, I'm also optimistic, and I believe that since we have no other choice, if we really want to sustain here as humanity, we will have to adopt the healthy and sustainable diet, and which means that in most part of the industrial world, we will have to adopt and decrease dramatically the meat consumption, the animal protein consumption, but not less the consumption of ultra-processed food. I think in Israel we have another obstacle, that the farmers are not considered as national assets, and the notion is that we can import food anytime if we have money. And as environmentalists, we know that the crises that are ahead hints that it's not sure that we will be able to do that. So I think to collaborate and to give a real focus on the importance of farmers and Israeli agriculture, not to prevent any import, but to make sure that we grow here the heart of the Israeli Mediterranean diet. Of course, there are many other obstacles, but this is just to mention.
Yeah. Sure. Oh, I see there are questions. One said, I also saw sugar honey in the green food basket slide.
So if someone saw it, maybe it's a mistake. I must say that someone prepared the slide for me, so maybe there is a mistake, but so we make it clear, sugar is not on the green side. It even carries the label red under the Ministry of Health recommendation. So if it is in the green side, it's a mistake.
There are Dorit questions referring to your statement about having farmers be assets. What are the actions required to change the status of farmers in Israel? And maybe you could say a few words. How would you tackle this issue of turning them into national heroes?
Well, it's a great question. What is obvious is that farmers today confront unbelievable obstacles and risks, actually, if they continue to grow. We have to make sure they have a safety net, economic net, that will enable them to keep growing the food. Of course, we need to have incentives in order to direct them to grow the food basket that will be decided that this is what the national security of Israel demands. And for this, I think a lot of advocacy should be done and work in order to change and legislate in favor of their, I would say, net of safety net. This is one part, and I think a big advocacy should be done among economists, especially, that their notion is that we need to open the market for imports of any food, and they actually consider food as any other commodity. And as we know, food is not a commodity; it's a right and it's a necessity, and it's not obvious that we always have it as we need. So I think there is a big work should be done here in many silos in order to change that.
Thank you very much, Dorit. I think we will end here. We had great speak day, and I hope all of you enjoyed this end of year webinar. We're looking forward to seeing you in our next ones in the next year. And we're looking forward to your collaboration and help. We should do this together in order to change the system in Israel. And so again, thanks to all the organizers of this event, those people that you can't see that are behind the screen, the background, have been working a lot that everything is working. Thank you so much. And again, for the museum, the Steinert Museum of Natural History, thank you so much for your collaboration. And have a good night from Israel, and stay well and healthy. Bye-bye.
Bye-bye.